Yeah, welcome all of you. Again, thank you so much for joining. We are very much pleased and happy to inform that we are back with a webinar series in association with Maharishi Ayurveda. Maharishi Ayurveda is one of the leading Ayurveda organization around the world. They are exhaustively present across the globe, US, North America, Latin America, Europe, and many other parts of the world, and including India. And in India, they are now re-strategizing entire aspects, how to connect with Ayurveda doctors, how to spread awareness about Ayurveda. The quality is their USP. I repeat, the quality is their USP. They never compromise on the quality. Personally, we are, I think, recommending and prescribing so many medicines from Maharishi Ayurveda from so many years, including so many doctors in our country. All the leading Vaidyas and doctors are very much aware, and everybody is in this opinion that the quality of Maharishi Ayurveda is always best and optimum. So again, I congratulate the entire promoters for that. Uh, and without wasting much time, I think in today's scenarios, these cardiovascular diseases are spreading like an epidemic, and so many people are dying at very young age. So that is a very crucial and significant aspect which we need to understand. We have Dr. Bhanu Sharma with us today from Maharishi Ayurveda. She is the leading of cardiovascular health, and we have Dr. Anurag with us today, and Dr. Vijay as well, the speaker of today, and Dr. Bhanu will be introducing both of the speakers gradually. So, myself, Vaidya, Dr. Piyush Ineja, founder IndianVaidyas.com. Again, welcome all of you in today's session. I hand over the session to Dr. Bhanu Sharma, senior Ayurveda consultant from Maharishi Ayurveda, a very young, dynamic, and experienced and knowledgeable Ayurveda doctor. We are looking forward to have a great session with you, Dr. Bhanu, and then Dr. Anurag and Professor Vijay also will be sharing their views about the session today. So again, I thank all of you for joining, and I request Dr. Bhanu to start the session. And please introduce about yourself and your organization as well. Thank you.
Yeah, thank you so much, Doctor, and thank you to my co-panelists also. So myself, Dr. Bhanu Sharma, I am proudly associated with Maharishi Ayurveda since past 10 years now. And I have completed my graduation from University of Rajasthan, and I am a constant learner. So in this particular series of learning, I have completed my diploma in nutrition, health and education. I have done my certification in Madma. I have completed my certification in Pulse, and at present also I'm doing my post graduation diploma in mental health sciences. So taking this topic further, so basically today we all have joined here to learn and understand more about the current situations of the cardiovascular diseases. Okay, so first of all, I would like to start with my organization. Basically, Maharishi Ayurveda. Hmm. Okay, so Maharishi Mahesh Yogi ji, who is a guiding light, who was a guiding light, and basically in 1959s महर्षि अंडरस्टूड कि शायद एक पॉइंट पर जाकर के एक समय के बाद में जितने भी डिजीजेस होने वाले हैं वो कहीं ना कहीं जाकर के मेंटल हेल्थ से परेशान होने वाले हैं लोग, इसको समझते हुए ही एक्चुअली इंट्रोड्यूस ट्रांसेंडेंटल मेडिटेशन इन 50s, क्योंकि शायद उनका फोर साइटेडनेस या जो उनका विजन था वो इस तरीके का था जो एंटिसिपेट वो कर पाए कि आगे आने वाले समय में मेंटल हेल्थ से ही सारी जो जितनी भी डिजीजेस हैं वो आने वाली हैं, और ये जो मेंटल हेल्थ है वो आपको फिजिकल इलनेस देने वाली है। तो इसी एम को लेते हुए उन्होंने एक मिशन दिया जिसका नाम था जिसका एक पूरा का पूरा एक विजन था कि उनको एक ऐसी सोसाइटी बनानी थी जो की पूरी डिजीज फ्री हो। और इसको आगे लेते हुए उन्होंने पूरी रिस्पॉन्सिबिलिटी जो थी वो हैंड ओवर करी हमारे लेट चेयरमैन सर श्री आनंद श्रीवास्तव जी। सो आनंद श्रीवास्तव जी वॉज अ वन पर्सन हु एक्चुअली हैज डिड so much for Ayurveda. Generally, to organizations we work with, to in the job roles we are into, that particular things help us out. But Anandji is the one who has done lot for this Ayurveda and Ayurvedic fraternity. इसी सबको आगे लेते हुए और इसीलिए मैं आज अपना जितना भी प्रेजेंटेशन है आई डेडिकेट टू माय लेट चेयरमैन सर। इसीलिए चेयरमैन सर जो थे उनका बहुत ही नोबेल मिशन था। उन्होंने 1980s के अंदर महर्षि आयुर्वेदा को स्टैब्लिश किया और बहुत ही ऐसे एफिकेशियस फॉर्मुलेशंस को उन्होंने बनाया। उसके बारे में उन्होंने उनको एक प्रॉपर तरीके से फॉर्मुलेशंस लेकर के आए और उनको पूरे तरीके से वैलिडेट करने के लिए बहुत सारी साइंटिफिक रिसर्चेस हुई, बहुत सारे क्लिनिकल ट्रायल्स हुए और इस तरीके से महर्षि आयुर्वेदा का लेट डाउन फाउंडेशन हुआ। और आज हम 37 ईयर्स से इस पूरे के पूरे ग्लोबली हम प्रेजेंट हैं एंड वी आर प्रेजेंट इन ऑलमोस्ट 40 कंट्रीज ऑल ओवर द वर्ल्ड। सो टेकिंग दिस फर्दर, महर्षि आयुर्वेदा जो है उसकी एक्सपर्टीज 35 ईयर्स से ज्यादा है और कुछ हमारे पास में ऐसे सर्टिफिकेशंस हैं लाइक महर्षि आयुर्वेदा वो established in 1986 and it launched its first international operations in 1987. महर्षि आयुर्वेदा का सबसे पहला जो पेपर जो पब्लिश हुआ था that got published in 1989 and in 1999 Maharishi Ayurveda got the first company to get its first ISO certification. 1999 के अंदर महर्षि और ये जो ISO सर्टिफिकेशन है वो एक बेंचमार्कर है इंटरनेशनल ऑर्गेनाइजेशन फॉर स्टैंडर्डाइजेशन के लिए। In 2000 MA got a certification for HACCP। तो HACCP जो है बहुत वो एक्चुअली ये इम्पोर्टेंट है कोई भी फूड एंड सेफ्टी मैनेजमेंट के लिए। In 2007 MA got GLP, that is a good laboratory practices. This is a certification as per WHO GMP, and this actually indicates a quality control system. Then in 2010, MA was awarded with Ayush Premier Mark. This was awarded by the Ministry of Ayush, and this certification is for the quality products moving in domestic and international market. In 2011, Maharishi Ayurveda received an NABL certification. तो ये जो NABL certification है वो भी आपको importance उसका ये है कि वो ensure करता है कि quality and technical competence of the lab. Then in 2017, one of the premium certifications received by MA was Cosmos Organic Certificate, Cosmetic, Organic and Natural Standard. Now this has an importance because ये आपको organic and natural cosmetic products in the Europe को indicate करता है. So these are the certifications which we have जो ensure करता है कि एक प्रॉपर जिस क्वालिटी और अश्योरेंस के साथ में महर्षि आयुर्वेद ने स्टार्ट किया था वो आगे तक अभी भी वो हमारा उस स्टैंडर्ड को वो मेंटेन रख रहा है। Okay, so now why we have actually come together is to discuss about the cardiovascular diseases. So basically alarmingly किसी भी youngster के लिए इसलिए होता है जब या तो उसकी जो कंपनी है वो एक ब्लड टेस्ट करवाती है उसके and then the lipid profile actually comes out to be in a big number, या कभी random वो किसी डॉक्टर के पास गया और उसका जो ब्लड प्रेशर है वो बहुत रेज निकल के आता है and then actually there is some तब उसके लिए वो अलार्मिंग साइन होते हैं। लेकिन पॉइंट ये है कि इट हैज बिकम कार्डियोवैस्कुलर डिजीजेस जिसको हम ग्रुप ऑफ डिसऑर्डर्स ऑफ हार्ट एंड ब्लड वेसल्स बोलते हैं हैज इमर्ज आउट टू बी अ big emergency because the numbers which are presented on the screen is actually scary. What is it? It is like 18.6 million deaths every year from CVD. 33% of all the global deaths are happening एंड सबसे बड़ा जो प्रॉब्लम है ये है कि 75% से भी ज्यादा जो डेथ्स हो रही हैं दैट इज अमंग द लो एंड द मिडिल इनकम ग्रुप्स। एंड ये जितना भी फिगर है वो हमने एक्सट्रैक्ट किया है बहुत ही रिलायबल सोर्सेज से और ये जो नंबर है वो बढ़ता जा रहा है। द पॉइंट इज इफ यू सी तो ये है कि आपका जो 20 से 39 का जो एज ग्रुप है उसमें से एक जो आपका यंग 20 से 39 के बीच में अगर हम 10 लोगों को अगर हम देखें तो one among them is actually getting affected by the heart disease. An estimated 17.9 million people have died from CVDs in 2019, which is representing 32% of all the global deaths. This figure we have received from WHO's website. तो ये हमारे को सोचने की जरूरत है इसीलिए शायद आज हम सब इकट्ठा भी हुए हैं, बिकॉज द पॉइंट इज कि ये हमारी यंग जनरेशन, यंग इंडिया को इम्पैक्ट दे रहा है। एंड दिस इज वाई दिस इज ट्रेंडिंग इज बिकॉज हम लोगों का ये जो पोस्ट कोविड ये ट्रेंड बढ़ता जा रहा है, मे बी बिकॉज ऑफ द कोविड के बाद के आफ्टर इफेक्ट्स हैं ये, मे बी बिकॉज ऑफ द वर्क स्ट्रेस पीपल आर इनटू, बिकॉज ऑफ द हाइब्रिड कल्चर दे आर इनटू, द मोर ऑफ द टारगेट, द मोर ऑफ द स्ट्रेस, लेस ऑफ द sleep, basically the quality of life has reduced, so that is why this number is increasing, and this has to be taken care of. Much more awareness has to be generated among the youngsters. Okay, so now we talk about the risk factors for the CVD. Why this is actually happening? See, high blood pressure, which most of the time gets unnoticed. हाई कोलेस्ट्रॉल लेवल, जब तक आप टेस्ट नहीं कराते, लोगों को शायद पता ही नहीं होता, तब तक ये बहुत सारे डैमेजेस हमारी बॉडी में कर चुका होता है. Overweight and obesity, because people are into hybrid culture, so the weight, they are eating all sort of unhealthy food without thinking about the calories, they are not taking it proper sleep, इसकी वजह से उनको वो overweight होते जा रहे हैं, and obesity is actually increasing. Then is the physically people are getting very inactive, sedentary है, no workout is there, इसकी वजह से it is causing the obesity. और एक तरीके से एक vicious chain चलता है इन सब का. Diabetes, tobacco intake, kidney diseases and harmful use of the alcohol. हमें पता है कि alcohol किस तरीके से damage करता है, but then still this is one of the reason. And the important factor is the air pollution. एयर पोल्यूशन, बहुत सारी रिसर्चेस हैं विच आर सपोर्टिंग टू दिस, विच सपोर्ट्स कि जितना हम एयर पोल्यूशन या हम पोल्यूटेड एयर के एटमॉस्फेयर में रहते हैं, उतना आपके जो कार्डियोवैस्कुलर डिजीजेस हैं वो बढ़ते चले जा रहे हैं. Apart from all this, we people, this platform is of the Ayurveda fraternity. We know that the mental stress factors are also there, which are working alongside and which are actually, adding to the CVDs. अभी वो कैसे हो जाता है ये हमें समझने की जरूरत है, because now what is happening is we have put here a point known as physical inactivity, the sedentary lifestyle. बट हम बहुत सारे इन दिनों रिसेंट में हम न्यूज में सुन रहे हैं कि जो लोग हैं वो बहुत ज्यादा एक्टिव हैं, जिम जा रहे हैं, दे आर डूइंग ऑल सॉर्ट ऑफ एक्सरसाइजेस, बट स्टिल दे आर डाइंग बिकॉज द कार्डियोवैस्कुलर डिजीजेस. व्हाई? बिकॉज अति strenuous exercises, more of exercises there, then also it will create some sort of problem. Then विषादो व्याधि वर्धना नाम, यानी कि अगर आप जितना स्ट्रेस में हैं, जितना डिप्रेशन में हैं, that also add to our problems. अति लंघन, लोगों को वेट अपना कम करना है, इसकी वजह से भी दे आर ईटिंग टू लेस, इसकी वजह से भी उनको सीवीडीज की प्रॉब्लम हो रही है. ओके, लेकिन आज हम इसको थोड़े दूसरे पर्सपेक्टिव से समझते हैं, दैट इज द पर्सपेक्टिव ऑफ द फ्री रेडिकल्स. We all know that the free radicals are responsible for creating more than 50 type of diseases in our body, and one among them is the CVDs. तो वो कैसे होता है? देखिए, फ्री रेडिकल्स जो है हमें पता है कि बहुत ही अनपेयर्ड इलेक्ट्रॉन होता है, दैट्स अ वेरी हाईली रिएक्टिव एंटिटी, और इस वजह से वो क्या करता है कि इतना एक्टिव होता है अपने आप को स्टेबल बनाने के लिए, वो लगातार वो एक चेन बनाता जाता है, इसको हम बोलते हैं ऑक्सीडेशन, और इस तरीके से वो हमारा जो सेल है उसी को डैमेज करता जाता है. लेकिन हमको अगर बैलेंस चाहिए तो उस बैलेंस को मेंटेन करने के लिए एंटीऑक्सीडेंट्स हमारे सिस्टम के अंदर होते हैं. तो जितने फ्री रेडिकल्स आपके सिस्टम में हैं और जितने एंटीऑक्सीडेंट्स हैं, अगर ये बैलेंस मेंटेन रहेगा तो दिस विल यू विल बी इन अ स्टेट ऑफ हेल्थ. बट लेकिन अगर किसी भी वजह से अगर ये बैलेंस अगर आपका बिगड़ता है, मे बी बिकॉज ऑफ द लेस एंटीऑक्सीडेंट्स देयर इन योर सिस्टम, इफ यू आर एजिंग, तो इसकी वजह से द मोर ऑफ फ्री रेडिकल्स वुड बी देयर and less antioxidants would be there, and the more oxidation will happen into your system and we fall ill. Okay, so now how these free radicals are basically leading to the CVDs. So as I have already mentioned कि disturbance हो रहा है इस पूरे equilibrium के अंदर free radicals and antioxidants के अंदर, which is actually creating a sort of oxidative stress and initiates a subcellular changes. एक्चुअली होता क्या है, अगर आप इस पूरे पिक्चर को अगर आप देख सकें तो ये एक हेल्दी सेल है, लेकिन इस पूरे हेल्दी सेल के ऊपर अटैक हुआ है लॉट ऑफ बाय द लॉट ऑफ फ्री रेडिकल्स. तो आपके इस बॉडी के अंदर एक ऑक्सीडेटिव जो स्ट्रेस है वो डेवलप होता है. इफ यू सी द पिक्चर बिलो, तो ये आपके पूरे के पूरे सेल को इसने डैमेज कर दिया. और इसी तरीके से इस पूरे के पूरे ऑक्सीडेटिव स्ट्रेस की वजह से एक सब सेलुलर चेंजेस होते हैं, एंड दिस इज डैमेजिंग द मसल्स इन द सेल ऑफ आवर सिस्टम एंड लीडिंग टू द मोर ऑफ द कार्डियक स्ट्रेस एंड हार्ट फेलियर्स. अगर इसी चीज को अगर मैं थोड़ा सा और अगर आगे लेकर के चलूं, तो you get the picture from here. See, we all know that the cholesterol is important for our system, ठीक है, लेकिन जितना ऑक्सीडेशन आपके बॉडी में हो रहा है, and if you have less antioxidant into your system, the bad cholesterol will get more oxidized and the more foam cells will be formed. तो इस तरीके से आपका जो ब्लड वेसल्स है उसमें एक प्लेक फॉर्मेशन होता है एंड विच विल ब्लॉक द आर्टरीज. दिस नैरोइंग ऑफ द आर्टरीज लीड्स टू द एथेरोस्क्लेरोसिस. एक लो ब्लड फ्लो मिलेगा क्योंकि उसको पैसेज कम मिल रहा है. Then the low oxygen will reach to your heart, and this will cause a pain in our system, and this is known as angina pain. तो आई थिंक यहाँ तक आई एम वेरी मच क्लियर कि व्हाट आर द कॉजेज, एंड ये हम डिस्कस कर चुके हैं, और हम सब वैसे भी हम एक फ्रेटर्निटी के, वी नो एक्चुअली व्हाट आर द कॉजेज. लेकिन अब बात ये है कि हमें समझ में आ गया, बट नाउ व्हाट इज द सोल्यूशन, बिकॉज द लाइफस्टाइल, द वर्क प्रेशर्स, the targets, the competitive world, the environment, everything is going to remain the same. What is the solution? महर्षि का एक विजन था, इसी वजह से उन्होंने शायद एंटिसिपेट कर लिया था, तो इसलिए उन्होंने अपने बहुत ही अच्छी टीम के साथ में एक सोल्यूशन के साथ में वो आए. And the solution came to be as Maharishi Amrit Kalash, which we call it as a super asana for perfect health. Now, how actually it helps us out? ये एक पूरी टीम थी जिसने मिलकर के अमृत कलश को बनाया. वी ऑल आर अवेयर ऑफ डॉक्टर बृहस्पति देव त्रिगुणा जी, फॉर्मर लेट जो त्रिगुणा जी हैं वो पद्म भूषण अवार्डी हैं. He was a former advisor to the Indian government, former president of All India Ayurvedic Congress and director of National Ayurveda Academy of Ayurveda. इन्होंने और इनके साथ मिलकर के लेट डॉक्टर बलराज महर्षि, इन्होंने इस पूरे फॉर्मुलेशन को बनाया और बनाने के बाद में ये इंश्योर कैसे हो कि जो हमने बनाया है वो इतना इफेक्टिव है. तो इसीलिए बहुत सारे क्लिनिकल ट्रायल्स हुए, बहुत सारी रिसर्चेस हुई. MAC is like, 79 total research studies have been conducted and which have been published in a very prestigious journals. It is the most highly researched brand in wide variety of disease segments in entire Ayurveda industry. So kahan researches हुई? If we just look into this global map, the one research was done in Canada. The second was in conducted in USA, Ohio University. One was in the Maharishi University of Management Fairfield. Another was conducted in the Netherlands, University of Lausanne. Then another was conducted in the Japan, in a very prestigious university like KGMC Lucknow, AIMS, and SMS Medical College, Jaipur. तो इस तरीके से अगर आप देखें तो वर्ल्ड वाइड बहुत सारी ऐसी प्रेस्टिजियस यूनिवर्सिटीज हैं, और ग्लोब में मेरे ख्याल से कुछ ऐसा छूटा नहीं है जहां पर इसके पूरी रिसर्चेस ना हुई हो, और वहां से हमें बहुत वंडरफुल रिजल्ट्स मिले, और वहां से ये प्रूव हुआ कि दिस इज इफेक्टिव इन द केसेस ऑफ एथेरोस्क्लेरोसिस, एंजाइना, चेस्ट पेन, IHT के अंदर, और कोमॉर्बिड कंडीशन जो है CVD की, लाइक डायबिटीज एंड हाइपरटेंशन, इट इज इक्वली इफेक्टिव देयर ऑल्सो. So basically, when we say that Amrit Kalash is that effective and it is giving us wonderful results, so you should know about what exactly the Amrit Kalash is. It composed of two things. One is the MAC nectar, which actually has more than 40 herbs. It is in a form of avle. तो जितने भी इसमें 40 herbs हैं, they synergistically and all together, see, in itself they are rasayanas. वी नो कि रसायन किस तरीके से हमारे पूरे के पूरे सिस्टम को इंटैक्ट रखते हैं. तो वो अपने आप ही वो इतना पावर पैक्ड है कि वो आपको एंटीऑक्सीडेंट का रोल फॉलो कर रहे हैं. लेकिन ये सब के सब जब एक साथ मिलते हैं, दे वर्क वेरी इफेक्टिवली एज अ पावरफुल रसायना, and together they form a full spectrum antioxidant which our system requires. If you look at the herbs present into it, तो बहुत इफेक्टिव हर्ब्स हैं, जैसे कि आंवला है, हरीत की है इसके अंदर, शंख पुष्पी, याष्टी मधु, विडंग, मंडूक पर्णी, नागर मोथा, इस तरीके के बहुत सारे ऐसे हर्ब्स हैं जो अपने आप में रसायना है, एंड टुगेदर दे आर गिविंग अस ट्रिमेंडस रिजल्ट्स। और ये सारे के सारे प्रोसेस्ड होते हैं इन दी दशमूल। इसके अलावा वी हैव टैबलेट नोन एज मैक एम्ब्रोसिया, जिसमें 13 तरह की और हर्ब्स होती हैं विच वर्क्स एज अ डी स्ट्रेसर एंड एनर्जाइजर। हम जानते हैं कि सीबीडी इज हैपनिंग इन आवर सिस्टम बिकॉज ऑफ दिस स्ट्रेस एंड एंजाइटी, या जितना भी वर्क प्रेशर है, तो हमको एक डी स्ट्रेसर भी चाहिए। तो अगर आप देखेंगे इसके कॉम्पोजिशन में, तो वी हैव अश्वगंधा या श्री मधु, ये सारे के सारे जो है अडेप्टोजेनिक हैं विच हेल्प्स योर बॉडी टू फाइट अगेंस्ट ऑल सॉर्ट ऑफ स्ट्रेसेस। ओके, सो दिस इज अबाउट द मैक4, ये इसके इंग्रेडिएंट्स हैं। लेकिन अगर हम देखें कि हाउ एक्चुअली दे आर वर्किंग एज, तो इनके जितने भी इंग्रेडिएंट्स हैं वो इन इटसेल्फ दे हैव बीन वर्किंग लाइक मे बी ये स्लाइड थोड़ा सा विजिबल नहीं है, बट आई टॉक अबाउट द सम की इंग्रेडिएंट्स, द की हर्ब्स विच आर प्रेजेंट इन द मैक विच आर वर्किंग एज अ कार्डियो प्रोटेक्टिव। तो सबसे पहला जो मोस्ट इंपॉर्टेंट जो इसमें हर्ब है, दैट इज द आंवला। इट हैज एन एक्टिव कॉन्स्टिट्यूएंट ऑफ गैलिक एसिड एंड एस्कॉर्बिक एसिड which increases the cardiac glycogen levels, and it is helping in decreasing the TG, triglycerides and LDL levels. Then you have manduk pani into it, जिसका एक्टिव कॉन्स्टिट्यूशन की वजह से अगर हम देखें तो वो मायोकार्डियल डैमेजेस से आपके हार्ट को बचाते हैं। अश्वगंधा इज देयर विच हैज एन एक्टिव अल्कलॉइड नोन एज विथेनोलॉइड्स, जो कि आपके कोलेस्ट्रॉल लेवल्स को मेंटेन रख के ऑप्टिमम ब्लड प्रेशर को अटेन करवाते हैं। देन वी हैव पुनर्नवा, जिसके अंदर पुनर्नवीन करके एक एक्टिव कॉन्स्टिट्यूशन है विच इज एक्चुअली हेल्पिंग यू इन रिजुविनेटिंग प्रॉपर्टीज एंड प्रोवाइड्स रिलैक्सेशन ऑफ हार्ट मसल्स। देन वी हैव दालचीनी, जिसकी वजह से आपका कार्डियक हीमोडायनेमिक्स मेंटेन रहता है, द ब्लड फ्लो मैकेनिज्म एक्चुअली रिमेन्स मेंटेन्ड। ओके, सो उसके अलावा वी हैव पीपली इनटू इट, जिसमें पाइपरिन नाम का है, जो कि आपका विच डिक्रीजेस द वैस्कुलर वीकनेस एंड फैटी डीजनरेशन। हरीत की, with the presence of the glycosides in harit ki, it is actually working as an anti-inflammatory. Turmeric, we know it is an Ayurveda fibrinolytic activity is there. It has curcumin into it, which inhibits the platelet aggregation. Then Safed Chandan, which is a strong antioxidant, and it regulates the nitric oxide levels. So these are the various herbs present into it, and they're helping us in combating the heart diseases. ओके, सो एज वी हैव डिस्कस अबाउट हाउ द मोड ऑफ एक्शन इज, हमने जिस तरीके से डिजीज आपकी बॉडी में मैनिफेस्ट कर रहा है, बिल्कुल उसी के को अगर हम समझ जाएं, तो फिर इट इज वेरी इजी फॉर अस टू एक्चुअली फाइट द डिजीज ऑल्सो। वी सेड दैट की जो फ्री रेडिकल्स हैं, दैट इज अटैकिंग द बैड कोलेस्ट्रॉल, एंड इट इज ऑक्सीडाइजिंग द लिपिड LDL, and it is causing the plaque. Now what actually MAC is doing? MAC is actually providing you with the ऑल सॉर्ट ऑफ एंटीऑक्सीडेंट। तो वो क्या कर रहा है कि वो आपका जब मैक आपकी बॉडी में जाएगा, तो ये पूरे के पूरे इस जो ऑक्सीडेशन के प्रोसेस है उसको रोकता है। सो हाउ दिस विल हैपन इज कि आपका जो बैड कोलेस्ट्रॉल जो कन्वर्ट होकर के ऑक्सीडाइज होकर के आपकी बॉडी में जो आपके ब्लड वेसल्स में जो प्लेक्स क्रिएट कर रहा है, तो उस ऑक्सीडेशन को ही वो रोक देगा। जब वो ऑक्सीडेशन नहीं होगा तो प्लेक नहीं बनेंगे तो एथेरोस्क्लेरोसिस का प्रोसेस नहीं होगा, यानी कि नैरोइंग नहीं होगा। ब्लड जो है वो ऑप्टिमम लेवल में वहां से फ्लो करेगा, और जब ऑप्टिमम लेवल में फ्लो करेगा, देन ऑक्सीजन विल रीच इन एन ऑप्टिमम लेवल टू योर हार्ट मसल्स। तो एंजाइना जैसी प्रॉब्लम से हम बच के रह सकते हैं। So now what are the indications? So by this we have seen that it reduces the chest pain, it improves the ejection fraction and exercise tolerance, reduction in atheroma size and plaque, it reduces the blood platelet aggregation, it increases the resistance to LDL oxidation, it scavenges the free radical and reduction lipid peroxidation, and we all know what ejection fraction is. Okay, so now what I am claiming and what we are seeing is all, uh, we have a lot of studies across the globe which suggest that what I'm saying is actually true. We have everything on the paper. So one research which I would like to share with you is the research. Okay, so is the research which was conducted in SMS College Jaipur. So what were we found it in, actually 30 people were taken. तो उसमें 20 were the male and 10 were female, और 20 में से भी जो 11 थे they were the smokers. उनके ऊपर ये प्रॉपर रिसर्च हुई, सीजीएचएस की ओपीडी थी, उसके अंदर पूरा का पूरा आपका मेडिसिन डिपार्टमेंट की सीजीएच ओपीडी के हमने 30 पेशेंट्स को लिया, एंड दिस एंटायर स्टडी वाज कंडक्टेड for 6 weeks, and these patients were followed up to another next 2 years. तो हमने उसमें क्या देखा, हमने ये देखा, हमने कुछ पैरामीटर्स पेशेंट्स के लिए, जैसे कि उनका जो एंजाइना का जो पेन है वो उनको मंथ में कितनी बार, कितना फ्रीक्वेंटली आ रहा है, विद व्हाट इंटेंसिटी, व्हाट इज द इंटेंसिटी, कितनी बार उनको सब लिंगुअल जो अपना एस्पिरिन्स वगैरह हैं उनकी जरूरत उनको पड़ी। तो इस तरह के कुछ पैरामीटर्स को डिसाइड हुआ किया, और फिर ये आपके पूरे के पूरे टेस्ट हुए, पूरी की पूरी स्टडी कंडक्ट हुई, और हर बार 6 मंथ्स के बाद में उनका पूरा ब्लड काउंट होता था, ईसीजी वाज डन, इकोकार्डियो वाज डन, एंड इफ रिक्वायर्ड तो हम कुछ और टेस्ट भी उन पेशेंट्स के करवा के, एंड दिस एक्चुअली स्टडी वाज कंडक्टेड बाय डोगरा एट ऑल इन 1994। तो इस स्टडी से हमें ये पता चला कि देयर वाज अ सिग्निफिकेंट डिक्रीज इन मीन एंजाइना फ्रीक्वेंसी बाय 65% इन 6 मंथ्स। यानी कि जब 6 मंथ्स तक हमने जब पेशेंट को ये जब खिलाया तो उन्होंने ये देखा कि 65% तक देयर वाज अ डिक्रीज, और ये जो उनको जो अफेक्ट मिला था दिस सस्टेन्ड फॉर 2 years। यानी कि जब तक आप कोई मेडिसिन दे रहे हो तभी तक पेशेंट को इफेक्ट है ऐसा नहीं है, द इफेक्ट एक्चुअली सस्टेन्ड। इसी इसी रिसर्च से हमें एक और चीज जो मिली वो ये थी, द इफेक्ट ऑन ऑफ मैक ऑन एक्सरसाइज टॉलरेंस। यानी कि जो पेशेंट्स थे, पेशेंट जो थे उनका जो एक्सरसाइज टॉलरेंस था दैट सब्जेक्टिवली इंक्रीज, उनका जो टॉलरेंस था ट्रेडमिल टेस्ट का वो बहुत अच्छे से इंप्रूव हुआ। इट वेंट फ्रॉम 33% to 80%। दिस वाज अ सब्जेक्टिव इंप्रूवमेंट विद इन अ स्पैन ऑफ 6 months, एंड दिस एक्चुअली सस्टेन फॉर अनदर 2 years। अनदर आउटकम ऑफ दिस सेम स्टडी वाज कि इन्हीं पेशेंट्स के अंदर जो उनका जो सबलिंगुअल जो एंजाइनल टैबलेट्स वो कंज्यूम कर रहे थे एक मंथ में, दैट सब्सिक्वेंटली रिड्यूसेस फ्रॉम 17.37 से 5.8%। यानी कि देयर वाज अ डिक्रीज ऑफ कंजम्पशन बाय 67% इन 6 months। And the other outcomes which the Dogra et al found was a 21% reduction in severity of chest pain in 2 years, and 20% patients may increase of good cholesterol was found to be seen। ठीक है, सो नाउ दीज वर द गुड आउटकम्स। और फिर जितने भी पेशेंट्स थे उनमें एक जनरल वेलबींग, एक हेल्दी सेंस ऑफ वेलबींग, जो जिसको हम हमेशा आयुर्वेद का एक कोर माना जाता है कि ठीक है पीपल आर कीप टेकिंग द मेडिकेशन बट दे आर नॉट समवेयर डाउन द लाइन, उनको कहीं वो सेंस ऑफ वेलबींग नहीं मिल रही होती, बट आफ्टर कंज्यूमिंग अमृत कलश विद वॉट एवर मेडिकेशन दे वर ऑन, उनको एक सेंस ऑफ वेलबींग उनको महसूस हुआ। सो दैट इज समथिंग which is a tremendous and remarkable outcome। अच्छा, अब अगर हम बात करें कि इसको लेना किस तरीके से है, तो सी आई हैव मेंशन कि एक पेस्ट है और इसके साथ में टैबलेट्स आती हैं। So the nectar which we talk about is you have to take 1 teaspoon twice with milk or in an empty stomach। ठीक है, और उसी के half an hour पे you take the ambrosia tablet, one tablet twice a day with water, and after half an hour you eat something, because if you take everything empty stomach तो उसकी जो आपकी बॉडी में जो assimilation है that is much better। किड्स में अगर हम बात करें तो यू हैव टू रिड्यूस द डोज, वी ऑल आर वेदर्स, वी नो कि डोजेज हमेशा कम हो जाती है, बट वी हैव टू ऑलवेज सी द वेट, हाइट एंड एज ऑफ द किड। वैसे भी ये एक स्टैंडर्ड डोजेज है जो हम आपको सजेस्ट कर रहे हैं, बट द पॉइंट इज कि आयुर्वेदिक डॉक्टर्स बहुत अच्छे से जानते हैं कि इट्स अ व्याधि बल एंड रोगी बल, उसके हिसाब से डोजेज को हम डिसाइड करते हैं, बट इट इज नॉट रिकमेंडेड बिलो 5 years of age, इट इज नॉट रिकमेंडेड इन प्रेग्नेंट एंड लैक्टेटिंग women। And if you want to start it, always consult a Ayurveda practitioner. Okay. Now, so since we have a paste and paste contains sugar into it, so what is the option for the diabetic patients? Because diabetes and CVDs actually they go hand in hand. So इसीलिए the paste, the nectar form has been converted into the tablet form also. So in that case, you can have nectar tablet, and after half an hour, one can have ambrosia tablet twice a day, morning, evening, empty stomach. ठीक है. So another thing which we need to discuss is कि हमें पता है कि जो bad cholesterol है या जो high triglycerides, dyslipidemia, which is becoming very common these days, and we are finding this, under 20s also people are coming to us जिनका cholesterol बहुत out of balance हो चुका है. तो ऐसे के अंदर what is the solution? We have a solution by the name of lipomab. So we all know that cholesterol is actually required for our system, but due to our lifestyle it is getting oxidized और आपके बॉडी में बैड कोलेस्ट्रॉल कन्वर्ट हो रहा है. तो ऐसे में हमें क्या करना है, वी हैव टू इंश्योर कि वो ये जो ऑक्सीडेशन हो रहा है दैट डजंट हैपन. सो दिस एंटायर कॉम्बिनेशन हैज गूगल इनटू इट, ताकि वो स्क्रैपिंग इफेक्ट करके वहां पर जो डिपॉजिटेड जो प्लेक्स हैं उसको हटाए, कोलेस्ट्रॉल जो है उसका मेटाबॉलिज्म को वो ठीक रखे, और एथ्रोस्क्लेरोसिस जैसी जो कंडीशन है उनसे वो बचा के रखे. इट हैज भूमि आमल की, इट हैज मंजिष्ठा, सारिवा एंड पारिजान, विच एक्चुअली कीप्स योर लिवर हेल्दी. ठीक है. एंड देयर वाज अ रिसर्च आल्सो. उस रिसर्च में क्या था कि ये एक प्रॉपर एक क्लिनिकल फाइंडिंग हुई थी, जिसमें ये एक ओपन रैंडमाइज ट्रायल था, यानी कि जिसमें पेशेंट को भी पता है कि व्हाट ही इज टेकिंग, एंड डॉक्टर को भी पता है कि व्हाट ही इज प्रेस्क्राइबिंग टू द पर्टिकुलर पेशेंट. तो उसमें ये देखा गया था कि जब इस पूरे के पूरे को जब हमने 3 months तक दिया, तो देयर वाज सिग्निफिकेंट रिडक्शन in triglycerides and LDL levels, and the good cholesterol actually got improved by 2%, which is very significant, क्योंकि बैड कोलेस्ट्रॉल या ट्राइग्लिसराइड तो जनरली कम हो जाते हैं, बट जो आपका गुड कोलेस्ट्रॉल है, HDL है, वो कई बार इंप्रूव नहीं हो पाता. बट दिस हैपेंड विद लाइपोमैप. Okay, and then is a hypertension, which is, and the 5 C's are always associated with hypertension, यानी कि coronary artery diseases, chronic renal failure, congestive heart failures. हम जानते हैं कि cardiac arrest, ये सारी की सारी चीजें associated होती हैं hypertension से, and we all know that it is a रक्तगतवार. तो इसको हमें कैसे मैनेज करना है? For that we have Cardimap as a solution. देखिए, ब्लड प्रेशर जो है वो जरूरी तो नहीं है कि हर बार सिस्टेमिक इश्यूज की वजह से है. इट हैज गॉट लॉट टू डू विद योर माइंड ऑल्सो, द स्लीप, द स्ट्रेस यू आर इनटू. तो इसका जो कॉम्बिनेशन है, द वे द फॉर्मुलेशन इज, इट हैज सर्पगंधा, इट हैज शंखपुष्पी, इट हैज ब्राह्मी, इट हैज जटामाशी एंड पीपली. तो जो शंखपुष्पी ब्राह्मी जो है वो आपके स्ट्रेस लेवल्स को कम रखता है. Sargandha, we know it very effectively works in lowering down your blood pressures. Pipli will help in assimilating the thing, because वैसे भी we know कि जब तक अग्नि को हम proper नहीं करते, ठीक नहीं करते, तो any formulation will not work. So Pipli is there into it, and we have Jatamasi, which will bring a good quality of sleep, ताकि ये जितने भी फैक्टर्स सब मिला करके आपके सिस्टम में हाइपरटेंशन को लेकर के आ रहे हैं, गेट्स relieved. So basically the formulation is all about, not only just suppressing the symptom, but it is working on the root cause. Okay, so this is all about the products and the researches which we have, and these are actually very essential and very important, क्योंकि वो boost करते हैं कि हम जो prescribe कर रहे हैं हमारे patients को, will they help them out also or not. So this is actually boosting the confidence. But एक चीज को समझने की हमें ये जरूरत हो जाती है कि ये जितने भी टेस्ट या जो रिसर्चेस होते हैं वो हमेशा एक पर्टिकुलर टाइम स्पैन के लिए होते हैं या किसी एक लिमिटेड नंबर पे होता है. बट आई हैव बीन एसोसिएटेड विद महर्षि सिंस 10 years, and I have been prescribing this regularly to number of patients, and I have seen them working very effectively and with no side effects. So these are the solutions which my organization has actually brought, and I hope we continue to help and serve the society in the manner we have been. And with me on the same panel And I'm really proud to announce that actually on this particular panel, I'm sharing this panel with a very known doctor from RGUHS Bangalore 2000. I have a doctor from BMS. I'm sorry, I'm just missing the details. I have a doctor from Belgaum, Karnataka. He has done his MD in Swastharat from very, very reputed and a prestigious college of SDM College of Ayurveda, Taniruhala, Hassan, Karnataka. He has special training on yoga therapy, Vivekanand Yoga Anusandhan. He is a Samsan yoga teacher. From that day, he has actually got a certification of level 2. He has done his post graduation. He has done his doctorate from SDM College of Ayurveda in Hassan, Karnataka. So I'm really proud to be co-panelist of Dr. Vijay. Dr. Vijay, I hand over the platform to you now, and I'm really sorry if I've missed some sort of information. Thank you, doctor, and please enlighten us with the knowledge.
Am I audible, madam?
Yes, doctor. Yeah, doctor.
Yeah. Good evening to everybody. Myself, I'm Dr. Vijay Negdu, Professor and HOD in the Department of Sastrata, STM College of Ayurveda, Udupi, Karnataka. First of all, uh, okay, shall I? My screen is visible.
Yes, doctor. You are.
Slides.
No.
Just a minute. Okay. Yes, slides are visible, madam.
No, doctor.
Yeah. Uh, no. First of all, at the outset, I thankful to Maharishi Ayurveda Pharmacy, uh, Ram Shivatsaji, MD, Suzamshuji, Dineshji, uh, then Subramanya and all my friends, those are watching this webinar. So today I'm going to talking about the Ayurveda intervention on cardiac health. So let us start my presentation. So Ayurveda intervention on cardiac health. So this is one of the interesting topic after COVID. So after COVID, sudden cardiac arrest is a common thing because of lack of immunity. So we need to understand the cardiac disorders and the purview of Ayurveda. So myself, I'm Dr. Vijay Neglur, Professor and Head in the Department of Swastrutta, STM College of Ayurveda, Udupi. So recently we celebrated World Heart Day on 29th September. So the objective of celebrating the World Heart Day is to give awareness about the cardiovascular disorders, their prevention, diet and lifestyle modification. So, according to the research or according to the prevalence, it says that the WHO says that 17.9 million individual every year die from cardiovascular diseases. So this is the data we got from WHO. So it is common nowadays because of COVID. The sudden cardiac arrest is common nowadays. So this is a topic we can discuss various factors which are related to cardiovascular diseases. When you talk about Ayurveda, the nidhanas, the causative factors and types of hridrogas, the chikitsa related to hridroga, and the diet and lifestyle modification. So when you come to the Ayurveda, the basic objective of Ayurveda is swasthasya, swastha rakshanam, aturasya, vikara prashanam. The first and foremost motto of Ayurveda is the prevention of health of an healthy individual. And the second objective is aturasya, vikara prashanam. So treating the disease condition. So as myself belongs to Swasthruta, I'm giving more priority for prevention because prevention is better than cure. So cardiovascular diseases, is common. In a broad manner, we can talk, the blood vessels or, blockages in the blood vessels, it is related with notably atherosclerosis and the ischemic heart cardiac diseases. So these are the common entities which comes under cardiovascular diseases. And the objective or the motto when you talk about the treatment aspect, the prevention is the best. That is also a primary prevention. So to talk about Hridaya, Hridroga or Hridaya, first we'll have a discussion about Hridaya. Hridaya is one among the Trimarma. So it's one among the Sadhyo Pranahara Marma. So any injury to heart will end up with the death here. So it is one among the Kostanga. Hridaya is the mool of Pranavaha and Rasavasrotas. So Rasavasrotas and Pranavasrotas moola is Hridaya. The sthana for Vyanavayu, Sadhaka Pitta, Avalambaka Kapha, and the moreover, it's a Chaitana. The Chaitana is situated in this Hridaya. So, Ashru, Shramajanya, Shwasa, Vegadharana leads to Hridroga. When you talk about the causative factors, the Ashru, so control over the, controlling the tears will ultimately end up with Hridroga. And there are various classical explanations available in the text, especially Charaka Sutra, Shushruta Uttarasthana, and Madhavanidana. So let us discuss elaborately. The one more importance of Hridaya is, Hridaya is the seat of Ojas. It's a Chetana, Manas, and Atma. It's the seat of Chetana, Manas, and Atma. So this is a very important point that it's related with the heart is not only a pumping organ here. So when you talk about Ayurveda, it's a seat of Manas and it's a seat of Atma and it's a Chetana. So let us discuss about the nidhanas, the causative factors for these cardiovascular diseases, or what we may call hridrogas. Mainly ati ushna ahara, ati guru ahara sevana, adhika kashaya rasa sevana, shrama abhigata, then vegadharana. So these are all common entities for this hridrogas. So in general, so the bad habits, especially the smoking and alcohol consumption, is also one of are also the causes for this cardiovascular diseases. So abhigata, injury, and some of the food factors, ati sevana of ati ushna, guru ahara sevana, kashaya rasa sevana, will end up with the hridroga. So when you talk about the types, so there are in the classics there are different types of hridrogas are mentioned. One is Vataja, Pittaja, Kaphaja, Krimija hridroga, and when you talk about the Madhavanidana, there are 5 types is explained. So the first above 4 along with Sannipataja. So in this way, in the classics, in the Ayurvedic classics, there is a classification of hridrogas are mentioned here. So coming to the first and foremost is Vatika Hridroga Lakshanam. So this is a very, very important factor here. The most of the symptomatology is quite related with the ischemic heart diseases. So look at this, Vedana, the pricking pain will be there. Sudden, whenever the cardiac arrest will take place, sudden pricking pain will be there, and sweating will be there. There are different example is given in the classics, like beating with a stick, and pricking. So these are all the different types of pain one can feel in Vatika Hridroga. Coming to the Paitika Hridroga, so there are different types of Vedanas are there, different types of Daha is there, so Murcha is there, okay, Shosha will be there. So these are the main symptomatology of Paitika Hridroga. Coming to the Shleshmaja Hridroga or Shleshmika Hridroga, so Gauravata will be there, Kafasrava will be there. These are the two important symptomatology one can see in Shleshmika Hridroga. And coming to the Sannipataja, it's a combination of all, and it's a very painful and difficult to cure here. It's a combination of Vataja, Pittaja, and Kafaja, Rudroga. So this is very important, the Samprapti Vigatana, or what do we call the Samprapti, how the Rudroga will take place because of intake of Nidana Saivana, what happens, Dosha, Visheshan will be there, Dosha Prakopa will be there, Agni Mandya will take place, Ama Utpatti will be there, Ama Utpatti will be there. Then it mainly affects Rasava Srotas, okay, Rasava Srotas, and ultimately Rudroga. So that leads to Rudroga. So this is the Samprapti, in short, Samprapti of Rudroga. And coming to the one more entity which is stored in Ayurveda, that is Krimija Hridroga. It's a Krimija Hridroga. So there are different symptomatologies mentioned. And coming to this, the how the Krimija Hridroga will occur, so because of the Nidana, the increase of Kledata and Ahar Rasa. The Ahar Rasa enters into the Hridaya, and Kleda produces Granthi in the Marma Desha, and the Krimi Utpatti takes place and ultimately produces a Krimi Rudroga. So these are the symptomatology of Krimisha Rudroga. So these are the some of the Lakshanas are there. Shula is there, Stevana is there, Utkle will be there, Shota will be there. So these are all the symptomatology of Krimisha Rudroga. And coming to the important aspect, that is complications, and this is very important. The complications of Rudrogas, especially Brahma will be there, giddiness will be there, then Klama will be there, fatigue will be there, Sadha, depression is there, and Shosha, edema is there. Why we are talking about these, the Hridaya is a sthana of Manas. It's quite common here because nowadays the people are busy with their work, the office work, the stress. So stress is common in all sector here. So stress is ultimately is the main cause for Hridroga. So definitely the depression, fatigue, the manasika nidanas and sharirika nidana together produces these Hridrogas. So when you talk about Rudroga Chikitsa, there is a lot of descriptions are available in the text regarding Rudroga Chikitsa. I'm not going to deal all the Rudroga Chikitsa like Vataja, Pittaja and Kafaja. In a broader sense, when you talk about Rudroga Chikitsa, there are two classifications we can make. One is preventive and curative, as I already discussed here. Preventive measures, preventive measures we can give more priority here. So a lot of descriptions are available in the text, like we have to maintain our heart, okay, by taking a patya ahara vihara. So ahara and vihara both plays a very integral role in the prevention of cardiovascular diseases. So we have to take a proper food and lifestyle. So then only we can prevent the cardiovascular diseases. And sugar regularly, the exercises, and the stress free life. Okay, so first one is proper ahara, patya ahara, you can call wholesome diet. Second one is vihara, that's very very important. The normal regular exercises can prevent the cardiovascular disease, especially with drogas. And the third point is the stress. Okay, so we have to relax our mind. So if you are having a stressful life, come out from that stressful life and go for some of the measures like yoga, dhyana and other things, then only we can prevent the cardiovascular diseases. And coming to the probable treatment of Vataja Hridroga. So I'm not going to deal about Pittaja, Kaphaja and Sanipataja. In a short, Vataja Hridroga, especially Snehana. Snehana can be given, and Vamana, the decoction of Dashamula added with the Sneha and Lavana. So we can use formulation. So there is a description is available in Yoga Ratnakara regarding this Vataja Hridroga. So in general, Vamana is indicated, but we have to take care of the patient depending upon the symptomatology, the condition, the prakriti of the person. We have to plan for the treatment. So some of the kashayas are mentioned, in the classics, Panchakola, Kwata, Pippaladi, Nagara. So Kalkas are mentioned, Chunas are mentioned, especially Pippaladi is mentioned, Dashamuladi mentioned, okay, Dadimadi Churna is mentioned. So in this way, there are different Churnas are mentioned. When you talk about the Vatis, the Gutikas, so Gutikas, especially Prabhakara Vati is widely used here, and Shankara Vati is the one more Vati which is widely used in Hridrogas. But it varies depending upon the patient condition, depending upon the Prakriti, Karana, Sara, Samvahana. So by looking all those factors, one can decide the medicine. So this is the point of discussion here, Patya and Apatya. So there is a description is available. Shal is mentioned, Mudga is mentioned, Yava is mentioned, Jangala Mamsa is mentioned, Maricha is mentioned, Patola, Karavallaka. So these are the food articles which are conducive or wholesome for in Hridroga conditions, especially the Patola, Karavallaka, and Maricha. So Yava. So usually a less protein diet, you can call as a less calorie diet is indicated in Hridroga condition. And when you talk about apatya, Thaila is contraindicated. Amla rasa is quite contraindicated here according to Vankasena. So some of the adhika kashaya rasa sevana, kashayukta ahara sevana, and this digda bhojana, guru ahara bhojana, vatakara ahara vihara. So these are all contraindicated in Hridroga condition. So as I mentioned, it's the green gram, barley, so jangala mamsa, so pepper, bitter gourd, and pointed gourd. So these are all indicated in Rudra conditions. In apatya, so contraindications are, as I mentioned, so heavy for digestion. Guru Har is contraindicated, and stress. Okay, stress, excessive anger, smoking, the alcohol consumption. These are also one of the apatya in Rudra conditions. So when you talk about yoga, so yoga plays an integral role in cardiovascular diseases. So the objective of yoga is to relax the heart. So relaxing the heart is very important because the cardiac muscles are exhausted. So in this cardiovascular diseases, we need to give a rest. Especially Vishrantakara asanas, the relaxative asanas are indicated. Relaxative asanas which are effective in this cardiovascular diseases. And moreover, pranayama have a very important role in the prevention as well as promotion of this cardio diseases pertaining to heart here. So pranayama, the anuloma viloma pranayama, the Brahmari pranayama is more impact on reducing the stress. As early I mentioned that the stress is one of the important factor, and the stress leads to cardiovascular disease. To in order to control the mind, in order to control the stress, anxiety neurosis, we need to go for yoga. Yoga is the best answer for those conditions here. The Anuloma Viloma Pranayama, that is alternate breathing, and the Ujjayi Pranayama, Shitali, Sitkari Pranayama. So those are highly effective. Those are highly effective in cardiovascular diseases. And the last but not the least is one of the important factor is meditation. So meditation is very important. Meditation is very important. So dhyana. So there are different types of dhyanas are mentioned in this yogic text here. So yoga nidra is also mentioned. So it's having a wonderful effect in cardiovascular diseases. Deep relaxation technique. So when you are doing a deep relaxation technique, it relaxes the cardiac muscles and it gives a good circulation to the cardiac muscles. Hence, we can prevent the cardiovascular diseases by doing a meditation. So in this way, the yoga plays an integral role, especially the not tough asanas, heavy asanas, simple asanas, Vishrantakara asanas, relaxative asanas are indicated. So when you follow all the yogasana, there is no question of cardiovascular diseases. If the person is suffering from cardiovascular diseases, then you can do by the consult of doctor, by assessing your condition, one can go for yogasana, pranayama, and dhyana. So, as we know that Amrita Kalasha is a very important, we can call as drug for this cardiovascular diseases. As I mentioned, when you go through the ingredients of Amrita Kalasha, so definitely there is Arjuna is there. Arjuna is the best drug for Hridaya Roga, especially cardiac diseases. It is one of the ingredient in Amrita Kalasha. And one more important thing is, Amla. So look at the ingredient in grossly. Uh, See, Amla is there, okay. Then the Shamula is there, Chandana is there. Okay, so look at these all the ingredients. So those are all antioxidant, adaptogenic property, as we already discussed by Madam. So definitely, it's having a wonderful effect in cardiovascular diseases, as you know that it promotes or what you may call it prevents the premature aging, and it improves the heart health. It de-stresses and rejuvenation. Stress is also one of the important factor. Definitely one can withdraw from some of the drugs which are there in the amruta kalasha, that is jatamamsi. Okay, and it boosts the mental alertness. So by looking all the ingredients of amruta kalasha, is a nectar. Definitely it's a nectar for cardiovascular diseases, especially and stress and anxiety. So I would like to share a few of the research articles in front of you at the end. So one of the study shows that the inhibition of low density lipoprotein oxidation by oral herbal mixture of Maharishi Amrita Kalash. So this is one of the research. It clearly indicates, it's having wonderful effect in low density lipoprotein. Okay, so what we may call in general, it's bad cholesterol. It removes the bad cholesterol, and it's having a wonderful effect in the prevention of cardiovascular diseases. And one more study is there I would like to share. So the oxidation, or what you may call antioxidant property of this uh, the Maharishi Amrita Kalash is having wonderful effect in order to prevent the symptomatology, and even during the condition, those who are suffering from cardiovascular diseases is a adjuvant. We can call as adjuvant because of all the ingredients which are there. It's having a lot of antioxidant properties, and Jatamamsi. So it's a unique combination of all the factors. So one is, it has Rasayana Tantra is one of the branch which is stored in Ayurveda in order to improve the quality of the dhatus. Definitely look at the ingredients. All the ingredients will improve the dhatu. Okay, so dhatu, it replenishes the dhatus, and definitely it's having wonderful effect in you know in any dearrangements, in the improvement of the dhatus. And next point is, stress is one of the important factor, and the ingredients which are told in the Amrita Prash Kalash is having wonderful effect, especially in order to control the stress or mental health. And last but not the least, so it's having a pack of some of the drugs like Arjuna and other things. It's a wonderful effect in Rudroga. So with these, I some of the research studies I would like to quote in the cardiovascular diseases, SMS Medical College. You can I'm not going to deal all these research studies. You can refer in the website here. With these words, I conclude my presentation. And once again, I thankful to Ram Srivastav and Maharishi Ayurveda, the fraternities of all the managers, the representatives, all the members, those who are working in Maharishi Ayurveda. Really, you are doing good job. It's having wonderful effect since uh, 13 years. I'm using Amrita Kalash. It's having wonderful effect. I'm using in cancer conditions, in cardiovascular diseases. It's a nectar, in order to say, it's a nectar for cardiovascular diseases. With these words, I conclude. Thank you, one and all.
Thank you, Dr. Vijay. Thank you so much, and thank you so much for sharing your experience on MAC. And from behalf of Maharishi Ayurveda, I would like to really be thankful. I really want to thank you from behalf of Maharishi Ayurveda, and especially it was a proud moment for me to share a platform with you, such a learned person. I mean, and to get enlightened with the kind words you have shared and the knowledge you have. So I thank you again, and I hope the entire Ayurveda fraternity come in the same way on common platforms and keep on sharing their knowledge and keep on working hard uh, the way it is and face the challenge of the cardiovascular disease and fight with with a lot of confidence, boost, zeal with the new challenge of the CVD in a better manner.
Yes,
Okay,
madam. Definitely.
thank you so much. And with this,
So
we conclude the session. And if we have any questions we would like to take, else you can just drop the questions in the comment box and our team will connect with you. Thank you so much.
yes, once again, thankful to Srivatsoji, Dineshji, okay, Sudhamshuji, okay, all the, and uh, my representative, Subramanya especially from Udupi, Harishji, okay, they're all working well, they're doing well.
Thank you, sir. Thank you.
Yes, sir. So if you have any questions, we'll have a discussion.
No, no, sir. Here is no any question right now.
Okay, then. Shall we conclude?